Thank you so much, ladies and gentlemen. Kindly tell us, how have you spent your day using the best sticker that describes the day you've had? Myself, I've had a wonderful day. With me, we have Catherine Sidandi, who has been missing in action. We have Anne Wamonja, and of course, our presenter, Dr. Tayo Opakunle. You can tell us how your day was. You can tell us how your day was. I can see there is okay. Yes, thank you so much for finding time to come and join us so that we can listen to this particular topic that affects our business. What are the economic impacts of sickness or when people get unwell? Before we get into the discussion, I am going to tell you who are our sponsors tonight. As usual, we appreciate them wherever they are. Catherine, how are you? And Mamonja, how are you? Yes, our sponsors include Nile Front Cottages. It is in Ginger, a very luxurious cottage where you will find scenic views, and you shall have found value for your money, and you will remove the stress that you're having. You remove all the burnout that you have when you are in Uganda. Anyway, because we want you to enjoy this life wherever you are, we want you to visit Nile Front Cottages so that you can enjoy that money that you get. And when it comes to recruitment, when it comes to understanding emotional intelligence, we have Profiles International. They do psychometric tests. They train people on emotional intelligence. They do psychometric tests and all things that are related to psychology. If you want to recruit using psychometric tests, if you want to do emotional intelligence for your team, Profiles International is your place to go. Of course, when you want to go to Rwanda, Kigali, you will find K2 HR services. If you want recruitment, if you want employee relations, if you want reward and compensation in Rwanda, and of course, we know they are spreading their wings across the continent. It is K2 HR services that you need to consult. And when it comes to strength finding, we have Steadfast Quality Solutions in Uganda, where we have our good friend Herbert Zake, where they dig and dive into what makes people get paid because of very good competences and skills that they have. So if you're in Uganda, Steadfast Quality Solutions are your people to talk to. And when it comes to insurance, AAR are the people to talk to, and they say that you are in control when you engage them on matters insurance. And of course, when you go to Mombasa and the holidays are coming, because the holidays are coming, don't forget to go Hotel Sapphire, where you will be treated like a king, where you'll be treated like a queen, so that you remove the stress that you have had for the 12 months that you've been working. Then, of course, when you go to Nyanyuki, you will find Tufa Resort, a very classy establishment. You'll be very happy to have gone there. The aesthetics are pure brilliance. I have gone there. It is marvelous to be there at Tuva Resort in Nyanyuki. And of course, when it comes to learning how to make tables, how to make chairs, those very beautiful remade chairs and beds and etc. and other things related to good work, talk to Panessa Training Institute. And of course, there are people who love money like me and Dr. Tayo, and you want to save. Who else do you talk to? You talk to Port Sacco. They're in Mombasa. If you want to save so that you can get those premiums, those dividends from saving, please don't forget Port Sacco. And of course, for those people who love food, and I include myself in that list, and Anne, I am sure she is there, it is Sorted Kinyumbani. They are in Nyanyuki. They are in Nyanyuki. If you're in Nyanyuki, make sure you Google them and go and enjoy very good African food. Ladies and gentlemen, tonight we are going to look at the economic impact of illness. We know businessmen and entrepreneurs start business so that they can get profit, but there are certain things that can chew into the profits. Being sick. How does sickness impact the profitability, the productivity, efficiency of an organization? And of course, we have our good friend, Dr. Tayo Opakunle, physician, voiceover artist. I can't wait to hear his voice, because voiceover people have got the best voices. And he's also a content creator. Dr. Tayo is a medical doctor dedicated to advancing health and human potential. He's deeply passionate about empowering people to live productive, balanced, and impactful lives in and outside the workplace. With a strong foundation in medicine, Dr. Tayo combines scientific understanding with a human-centered approach to well-being. This is very good that you will find a scientist who is interested with human beings. It's believed that laughter is the best medicine. Wow, let us wait for him to make us laugh. He informs his workforce as a voiceover artist and content creator, where he uses creativity and communication to inspire healthy, more fulfilling living. Blending professionalism, empathy, and versatility, Dr. Tayo represents a new generation of healthcare professionals, those who see wellness, not just the absence of illness, but the presence of energy, purpose, and joy. Ladies and gentlemen, my brothers and sisters, me, your MC, who is standing in for grace, and of course with my fellow presenters, Catherine Shidandi, join me in welcoming Dr. Tayo. Dr. Tayo, karibu sana. In Kiswahili we say karibu sana. That means welcome, 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 welcome. Welcome on board. Tell us.
Asante. Thank you very much for that introduction, and it's very nice to be here with the Get It Right with Atara Solutions community, and it's a pleasure to meet you, Mr. Richard, and thank you to the community as well as Anne for allowing me to have this opportunity to address you all. So I am going to share my slides. So I shall begin. Okay, thank you everybody for taking the time to be here this evening, where I would like to talk about, usually as doctors, we're always talking about health. We rarely talk about the cost of healthcare or the effects that healthcare usually has on the economy. But it's something which is very, very important, as we'll go over in my slides. So I'll be talking about the economic cost of chronic illnesses, and that prevention at work isn't just charity, it's also smart business. Okay, so I'll just say a little something about me so that everybody can know who I am and what I stand for. Then we'll look at the global scale of this issue. Then we'll focus it down to Kenya and the economic losses that are suffered as a result of these chronic illnesses. We'll look at how these illnesses cause their impact on the economy. Then of the most important note, we'll talk about the importance of workplace prevention, a call to action, and then we can take questions after that. Okay, so Mr. Richard did a very fantastic job of introducing me. Thank you very much. I'm a medical doctor currently specializing in internal medicine, or a physician. So just so people know what internal medicine is, it is the specialty that deals with complex medical conditions as well as chronic medical illnesses. So if you ever have something like diabetes, hypertension, chronic kidney disease, certain kinds of cancers, those are usually treated by internal medicine doctors or doctors who have subspecialized in internal medicine. I'm extremely passionate that people get to live very healthy and empowered lives for as long as they possibly can. And my key message is always that prevention is better than cure. I'm currently based at the Karen Hospital, and I enjoy making content on social media. I'm also a voiceover artist. I enjoy doing public speaking, exercising, and most importantly, I love saving lives wherever I can. Okay, so if we get into it now, so in terms of the global scale of these chronic medical illnesses, the Harvard School of Public Health had estimated that, and we'll get into what this term means, that non-communicable diseases are projected to cost the global economy approximately around $30 to $47 trillion per year. And the reason why these non-communicable diseases are so specific, or why it's very important that we take these conditions into note, is that they tend to strike adults during their prime working years. And of course, when people are in the prime of their career, that's when they stand to make the most benefit to their countries and the economies as a whole. So for these conditions to drastically affect people during these years in their lives is something that we definitely have to take a lot of note of. So what are these chronic medical illnesses or non-communicable diseases that I'm here to talk about? So the beautiful thing with the phrase is it's kind of self-explanatory, that these are diseases which cannot be transmitted to another person. So that's what we mean by non-communicable disease. And these tend to be chronic diseases. They last a very long time. And they result as a combination of genetic, physiological in terms of the way our bodies work, both environmental and behavioral factors. Something which you might have heard about these diseases is that they're also sometimes known as lifestyle diseases, because the certain choices that we make in our lives can predispose us to developing these non-communicable diseases. The main types of these non-communicable diseases are cardiovascular diseases, such as heart attacks, heart failure, hypertension, stroke. Then cancers, all sorts of the different cancers, from breast cancer, prostate cancer, colorectal cancer, cervical cancer, all of the different cancers. Then there's chronic respiratory diseases, such as chronic obstructive pulmonary disease, as well as asthma. And then, of course, there's also diabetes, which is very, very problematic. So the key thing with these diseases is that people of all age groups in all regions and all countries are affected by these non-communicable diseases. And what we're seeing in terms of the epidemiological data is that the prevalence of these diseases is rising. These conditions are often associated with older age groups, but what the WHO has seen is that around 18 million non-communicable disease deaths occur before the age of 70 years on a yearly basis. So if we look at this heat map that's showcasing where the prevalence of these non-communicable diseases, as you can see, the countries that are, this is some data that was taken from 2008. Unfortunately, they were only looking at males, but we're seeing that it can also be reflective of females, as the prevalence in both men and women with these conditions is increasing. And as we can see, Kenya is roughly in the 700 to 800 deaths per 100,000 in the population. And if we look at Africa as a whole, the prevalence of these non-communicable diseases and these diseases causing death is quite high. And what makes this such a major problem, especially for Africa and Kenya as a whole, is that together with these non-communicable diseases, we still haven't yet cleared the major issue with infectious diseases themselves. So just to talk about some of the risk factors associated with these non-communicable diseases. So of course, we've all heard about the negative effects of tobacco smoking. Tobacco smoke is something which is it's very deleterious to your health. It's something which it should be avoided at all costs. And this also even includes exposure to secondhand smoke. Then, as I was saying, these are lifestyle diseases. So diet plays a very major role. And these are diets that include excess salt, sugar, and fat. And of particular note, these are diets that mainly consist of a lot of processed food. Is something which processed foods have been shown to drastically increase the chances of you developing things like hypertension, diabetes, and elevated cholesterol levels. Then there's the effects of excessive uses of alcohol. Alcohol is something which, if taken in very low amounts, doesn't have much effects on your health, but if taken in excessive amounts, is something which can result in a lot of different complications, from things affecting the brain, the heart, the liver, the kidneys. Alcohol, just like tobacco, is something which can have effects on multiple different organs. And then another major behavioral risk factor is insufficient physical activity or physical inactivity. In this modernized world that we now live in, versus our ancestors who are hunter-gatherers, for example. If you look at your day, it can be very easy to see how there's not much physical activity that occurs on a daily basis. Because if the typical person's day includes, they wake up in the morning, they get ready for work, then you either drive in your car, which is there's no physical activity there. You get to work, you then take the elevator up to whichever floor that you work on, and then you sit down on your chair at your desk for almost 8 to 10 hours a day, and then you drive back home, and then after that, you'd eat dinner or something like that, and then sleep. So in that day, there's very, very, very minimal physical activity. And physical inactivity has been shown to increase especially rates of diabetes, but also things like hypertension as well. Okay. So the next thing that we just need to talk about is also the metabolic risk factors. So we've talked about those behavioral changes, which then contribute to these metabolic risk factors. So physical inactivity, or poor diet, tobacco smoking leads to elevated blood pressures, in which then you can develop hypertension. And the problem with some of these non-communicable diseases is that they often stay very silent, causing a lot of damage to internal organs before they then present in a very catastrophic way, in the sense of somebody then having a heart attack or a stroke, somebody's kidneys are not working and now they need dialysis. So those behavioral changes that I was talking about can also lead to being overweight or obese, of which, in terms of in medicine, how we classify obesity is if your body mass index is greater than 25. There are different classifications for obesity, but what the evidence shows is that in individuals with a body mass index over 25, we then see an increased risk of developing these non-communicable diseases. Your body mass index is something which, if you have a weighing scale and you have something which you can measure your height, you can easily calculate it such that once you have those two parameters, you can input it into a body mass index calculator on the internet, and it will give you your BMI. Then high blood glucose levels. Once again, diets that are very heavy in processed foods. A lot of these things that we call high glycemic index carbohydrates, or what we call very simple carbs. Things like white rice, white ugali, white chapati, things like white pasta. These are foods, white bread as well. These are foods which spike your blood glucose levels, and over time it becomes harder for your body to regulate your glucose levels, which then, once your body is not able to regulate your sugar levels, that then causes diabetes. And once again, diabetes is another one of those conditions which stays very silent, causing a lot of different issues all over the body, until eventually it results in either a heart attack, a stroke, blindness, kidney failure. It can also even result in issues to the blood supply to the legs, which can even result in amputations. So these conditions can stay very, very silent for long periods of time, until they eventually cause very major issues. And then abnormal, essentially how we talk about high cholesterol, which is usually intertwined with all of these conditions. Hypertension, obesity, and diabetes usually also comes with high cholesterol. Not all the time, but usually we see these conditions come together. And then genetics plays a very major role in the development of these non-communicable diseases, where what we see is, if you have a very strong family history of things like diabetes, of hypertension, of certain kinds of cancers, especially cancers, the likelihood, it's not necessarily that you're going to develop these conditions, but if these behavioral changes that can impact your likelihood of developing these conditions are present in your life, together with a strong family history of these conditions, then genetics plays a very major role in the development of these non-communicable diseases. Then we also have environmental risk factors, of which the biggest environmental risk factor usually tends to be air pollution. I won't go into too many numbers about the microparticulate matter in the air, but one of the things that I always find funny is that whenever you go outside of Nairobi to any of these rural areas, the air always seems fresher, and that's because there's not as much air pollution as a result of major industrial activities that are ongoing. So now to make it more relevant to us here in Kenya, so there's 7 major non-communicable diseases that we're seeing that plague these 7 non-communicable diseases. They're affecting the whole world, but we'll talk about it in a Kenyan perspective, where in 2016, these non-communicable diseases resulted in estimated economic losses of up to 230 billion shillings, which at the time they approximated is about 3.4% of the country's GDP. And once again, this is a very major issue because we're still here in Kenya, we're still dealing with infectious diseases such as the different bacteria and viruses that cause pneumonia. We still have a lot of malaria in the country. And every so often, whenever the rains hit, we're always talking about cholera or these diarrheal illnesses, which these illnesses can also make these non-communicable diseases, if they're present, they can make them much worse. So the major non-communicable diseases that are affecting the Kenyan population. So first is cardiovascular disease, heart disease and stroke, majorly heart attacks and heart failure, which are usually a long-standing complication of having hypertension or high blood pressure. And one of the very interesting things, one of my senior mentors has told me, he told me that when he was doing medical school in the 1970s, he said in his 5 years of medical school, he only witnessed 2 heart attacks while he was a medical student. And usually a heart attack back in the 70s in medical school was such a rare thing, especially in the Kenyan population, that the whole medical school would discuss these cases when somebody had a heart attack, because it was so rare back then. But now at my workplace, I sometimes see 6 to 7 heart attacks in a week. In fact, even earlier this week, I was in the same day, I was dealing with 3 patients who had a stroke. So these illnesses have become very, very common, unfortunately. Then we have type 2 diabetes, which is another major condition which is increasing in prevalence. We have all the different kinds of cancers, from breast cancer, prostate cancer, cervical cancer, colorectal cancer, as well as esophageal cancer, of which the importance of bringing up these cancers is if there's a family history for these different cancers. If you have a family history of somebody having one of these cancers, it's very important to start screening for these cancers early. Then we have these chronic respiratory diseases, asthma, and chronic obstructive pulmonary disease. We're seeing a drastic increase in mental health disorders, both in the elderly as well as also the young. This being depression, anxiety, and also substance abuse. We're seeing usually a long-standing complication of these cardiovascular diseases or diabetes is chronic kidney disease, of which we'll talk about the importance of this slightly later. And then there's still the scourge of road traffic accidents, which usually result in long-term disability depending on how severe the accident was. So how these non-communicable diseases impact the economy is that it usually causes out-of-pocket health spending, such that either somebody doesn't have health insurance or their health insurance gets depleted as a result of the different hospitalizations they have to go through while having these conditions treated. And this out-of-pocket health spending can usually push households into poverty, both due to lost time at work, or unfortunately, in certain cases, being let go because of the inability to work. Medical debt, because healthcare is very expensive, unfortunately, which then can trickle into reduced spending towards education for the children. So this affects households' earning capabilities, and then the reduced efficiency at work also then impacts businesses as well. And of course, if people do not have as much disposable income to spend on different things, it reduces consumer spending, which then reduces the overall GDP of the country. So we'll get into some numbers now just to really see the impact of this. So, the average cost of treating a stroke when it occurs in a private hospital setting is around 1 million shillings for the admission. And then strokes, why strokes can be so devastating is because they require a lot of care afterwards, such as rehabilitation of things like speech, movement, learning how to take care of yourself once again. And those rehab costs can go anywhere between 100,000 to 150,000 shillings monthly. Then, for example, in a public hospital setting where I found some of this data, an an admission due to heart failure can cost somebody around 11,500 shillings per day, with an average hospital stay of around 10 days, which can result in an approximate hospital bill of around 115,000. And this is just in a public hospital. If we talk about a private hospital, some beds in private hospitals are more than these charges even. So yes, and that doesn't even mention the medication costs that are associated with these conditions. Then, in terms of some more data which I found about some reimbursements that the Social Health Authority has had to issue to different hospitals. So when somebody has chronic kidney disease, usually it then progresses to the point where the kidneys stop working completely, and the job of the kidneys has to be taken over by what we call dialysis, which is filtration of the blood to remove toxins and to remove excess water, which is the job of the kidneys, among multiple other things. So one hemodialysis session is reimbursed by SHA at a cost of around 10,650 shillings. And patients who require dialysis require at least between 2 to 3 sessions per week, which then means on a monthly basis, that's anywhere between 85,200 shillings to 127,800 shillings for one person, which then comes to about a yearly cost of between 1 to 1.5 million shillings for one individual. And by the time somebody requires dialysis, the statistics show somebody will then be on dialysis. They can be on dialysis for anywhere up to 5 to 20 years. So imagine one person utilizing up to 20 million shillings just for dialysis. We haven't talked about reviews in the hospital with a kidney specialist, as well as other specialists because of the conditions that having chronic kidney disease predisposes you to. We haven't talked about medications. Usually, these patients who require dialysis, before they go for their dialysis sessions, they usually start feeling quite weak, quite sickly, which then results in time missed at work, and we'll get into that shortly. Yes, and so of course, if this government-sponsored insurance is costing this much for just one person, it means the money has to come from somewhere, of which it usually comes in the forms of different deductions that are taken out of our paychecks. And for some NHIF data, before it was turned into SHA, some NHIF data showed that over a certain period of time, they didn't quantify the exact period of time, but up to 3.8 billion shillings was reimbursed to different hospitals in dialysis claims alone. Yes. So as you can see, this is usually what dialysis looks like, where somebody they have certain instruments that are inserted into their blood vessels, and then their blood vessels or those instruments are then connected to the dialysis machine, which filters all of their blood. Now, a dialysis session takes 4 hours, and usually dialysis is something which is very exhausting. So by the time somebody needs dialysis, usually their full day is taken up just getting ready to go for dialysis, having the dialysis done, and then resting for dialysis. Now imagine if, let's say, a 50-year-old requires dialysis and he was working prior. It means that essentially for 3 days in a week, out of a 5-day work week, that individual cannot go to work because he's going for dialysis. So we can see how that then causes losses of productivity, both for the individual and the business that he works for or she works for. So then these non-communicable diseases can also result in indirect costs, such as reduced productivity at work. It can cause increased turnover if certain people are not able to keep up with their responsibilities at work because of certain conditions. And one big culprit for this, which unfortunately there's a bit of stigma around, but we don't talk too much about, is actually mental health conditions, where somebody might be depressed at work. They're not performing very well, and so that then results in them being terminated. And so then the increased, I'm sure with the different HR professionals that are in this call, we know the costs of increased turnover, as well as the transition costs that come with that. Then there's loss of institutional knowledge. And this usually we see when, for example, if a corporation has invested a lot of time in training somebody, and then unfortunately that individual falls sick, or somebody has been at a company for a very, very long time, they haven't reached the age of retirement, but because of an illness which they didn't take care of, it results in them having to stop working. And that level of experience is not something which can be easily replaced. And then time lost due to hospital visits, as well as admissions. And then there's another very important concept to look at called presenteeism and absenteeism. So of course, absenteeism, because people have to miss work to either when they're admitted, or if they need to attend clinic or go for procedures. And it's been shown that on average, presenteeism and absenteeism can cost a GDP, it can cost about 0.5 to 2.2% of a nation's GDP. Presenteeism is reduced efficiency at work, likely because of dealing with these non-communicable diseases. The average hospital stay for a non-communicable disease in Kenya is around 10 days. And another thing, unfortunately, which is occurring as a result of this, there's a rise of multi-drug resistant infections that we're also seeing in hospitals. And from research that's being done, the WHO is estimating that they said by about 2050, treatment for multi-drug resistant infections will soon be the leading cause of healthcare costs that drive families into poverty. So if we once again make this a bit realistic and look at numbers, so why is workplace prevention so important? I just did some calculations where if the average individual who works 5 days a week, sleeps about 9 hours per day, spends about maybe 1.5 hours in a day eating, and has a career of about around 45, they have their productive years for about 45 years, from 20 to 65. It means the average individual spends 27 years of their life sleeping, 4 years of their life eating, and then 10 years of their life at work. And so we can clearly see that work is something which we spend a lot of time doing. So since we spend a considerable amount of time at work unfortunately sometimes can be the reason why we don't go for checkups, where individuals usually say that either they're exhausted from work, so finding the time to go to the hospital is difficult, or they just don't have the time in general to actually go to work, where they'd much rather spend their weekend, for example, relaxing versus going to a hospital for a checkup. But workplace checkups with timely screening can have a measurable return on investment, and we'll go through some numbers shortly. Early detection of chronic diseases make these diseases much cheaper to manage. There are fewer medications required if treatment is started earlier, and this then results in fewer hospitalizations, which means if people with non-communicable diseases don't get worse, they can still maintain almost normal levels of productivity, which then also reduces absenteeism and presenteeism in the workplace. And this also results in reduced insurance claims, which means preventing insurance premiums for corporations and for individuals from going up. So if we take a company that has 200 employees and the average salary of these employees is around 100,000 shillings per month, in their contract, these employees get 10 sick days per year, of which the daily wage divided by 22 days of working per month would come to around 4,545 shillings, which means the total cost of sick days for these 200 employees in this company would amount to around 9,090,000 shillings per year. Now, workplace health checkups reduce absenteeism by 20%, which would mean that around 1.8 million shillings would be saved as a result of doing these health checkups and the snowballing effect that they have in preventing these non-communicable diseases from getting worse. The usual cost of a workplace health checkup program, either in liaison with different companies that can do these wellness checkups, or in the form of insurance schemes that allow for wellness checkups, usually is around 600,000 shillings. That was the average that I was able to find, which would mean that the net benefit of doing of maintaining employee well-being would come to around 1.2 million shillings per year in this scenario. And this doesn't even include the fact that people would be working with increased efficiency or the reduced insurance claim reductions, which can often double or triple the return on investment with regards to employee wellness checkups. Then the importance of these screening checkups is that it results in employee engagement as well as morale, and staff tend to feel valued if they know their workplace is taking care of their health, which can then lead to better loyalty as well as higher productivity. It improves corporate reputation in the sense that companies with health programs attract top talent. And then there's reduced long-term disability claims, simply because chronic illnesses caught early may prevent prolonged disability or early exit from the workforce. There was some conferences I was attending around kidney care, where there are certain medications which can delay the onset of somebody requiring dialysis for up to 20 years if they're started in a timely basis. So workplace checkups should not be a nice to have. They are a cost-saving, revenue protecting, and productivity boosting intervention because they reduce costly sick leave. They can detect high-cost conditions early. They improve employee output and loyalty. They lower insurance claims as well as healthcare spending. And so in short, every single shilling that's invested in preventative health checkups can save multiple shillings in related to costs and lost productivity. So the core pillars for employers with regards to how exactly we can tackle or prevent the onset of these non-communicable diseases is with primary prevention. So trying to prevent these diseases from forming in the first place. We talked about the importance of diet. And I know, especially for anybody who works in an office setting, when it's lunchtime, what happens? People go out, they buy chips, they buy like fast food, they order takeout from different restaurants. And sometimes some of the things that tend to happen is that when some people start working for bigger or better companies, what happens is they gain weight because during their lunch breaks, they're spending their time eating these more highly processed foods. So for companies that do feed their employees, if the diet that they feed their employees can be much healthier in terms of complex carbohydrates, lean proteins, lots of fruits and vegetables. Encouraging physical activity be it in the form of gym memberships or a certain wellness retreat, or different fitness challenges in the office place. Uh, Having a tobacco-free policy at work to prevent employees from smoking, and then encouraging weight management. Yes. Then secondary prevention, in the sense that, okay, if we've diagnosed somebody with one of these non-communicable diseases, um, we screen for them early, either to diagnose them early or to prevent this condition from worsening. So this includes blood pressure checks, diabetes screening by doing a simple random blood sugar test, cancer screening, as well as mental health screening. And I was glad to hear that one of the sponsors is a company that specializes in mental health. Then, if somebody has unfortunately suffered from one of the complications of these non-communicable diseases, it would be very paramount that their workplace provides an enabling environment for them to still live a relatively productive life despite whatever might have happened, be it a stroke or heart failure or chronic kidney disease. And this would include things like being able to have flexible work hours, allowing time for continued access to clinics, insurance schemes, of course, to help with access to medication. So yes, so I know, especially since the HR professionals are here, of course, I found some key performance indicators that says these interventions in the workplace are actually making a difference. So if effective wellness programs should reduce absentee days, or absentee days per 100 employees should be tracked. And what we should see is that if these wellness programs are effective, then over the years, the amount of absentee days within a business or a corporation should reduce. Then presenteeism survey scores. Somebody who is healthy most likely is fully giving themselves to their work. So if people are reporting that they're enjoying their work, they feel like they're meeting their goals, they're doing the very best that they can in the workplace, that indicates that they are in a very healthy place. And so any of these chronic medical conditions is not affecting their efficiency in the workplace. If the amount of healthcare claims per employee or the total amount of an insurance premium that a company is paying to ensure their employee is not increasing, then that means that these wellness initiatives are actually effective. If there's reduced staff turnover, especially due to health-related issues, such as things like people having to retire from the workplace earlier because their body can't keep up because of these non-communicable diseases, or for example, people being let go because their performance is down because their mental health is poor at the moment. They're suffering from anxiety, depression. They're trying to cope with a stressful workplace by over-consuming things like alcohol or using substances to try to cope. If turnover reduces, once again, it indicates a healthier workforce. And of course, if employees are just participating in all of a business's activities, it means the likelihood of them missing out on participating in whatever tasks or are taking, whatever tasks are taking place, means that once again they have the ability to actually participate where needed. So one thing which, for any entrepreneurs here who are running a business, and as well as HR here, I'd like to task everybody with trying to implement this. Well, like either implement one of these bullet points I've put within the next 90 days, or even in 2026, since we're approaching the end of the year, to take employee well-being very, very importantly, because of the impact that we've seen that it has on the individual, the company, and the economy as a whole. So organize a day where um, uh, your employees' blood pressure and glucose can be checked on site in case they don't have the time to come to a healthcare facility to have these checkups done. Encourage tobacco cessation in the workplace, as well as also just forming forming support for any employees who use tobacco to cope with stress, having replacement partners or accountability partners so that they're not smoking in the workplace. The importance of managers and just employees in general to be trained on mental health first aid in case of any breakdowns that occur in the workplace, and how exactly to deal with that, and essentially empowering and encouraging employees to take care of their mental health. Nutritional changes in the workplace, as well as activity nudges. So healthy options in the canteen or whenever people order lunch, if the options can be healthier. Walking to meetings, or just providing people with the chance for more physical activity in their day. And then, of course, to actually schedule a proper day for a wellness checkup, where blood samples can even be taken to help screen for these conditions. This can either be done on site at the workplace, or a day where the employees are allowed to go to the hospital to have a wellness check that can be done. And usually what we encourage, the age where we usually start to worry, or where these non-communicable diseases usually tend to develop, is from the ages of 40 years old and onwards. And so we usually encourage a yearly wellness checkup. For me as a doctor, I usually encourage my healthy patients to go for a wellness checkup on a yearly basis, especially from the age of 40 onwards. The sooner we start, the better. Okay, so I've come to the end of my presentation. I think if there are any questions, I'd be happy to answer them. Any feedback, anything like that, I'd be very happy to answer. Thank you very much.
Thank you very much. Thank you very much, Dr. Tayo, for that very crisp presentation on how sickness affects productivity or affects the efficiency of organizations. Ladies and gentlemen, if you have a question, you can post it. If you do not have a question, now let us appreciate Doctor for that very informative presentation. Kindly pick any sticker emoji to appreciate Doctor for that presentation that he has been able to make. As people, yes, I can see, Doctor, you're being appreciated for that very wonderful presentation using a very powerful tool that God has given us, the voice. I'm sure you're using your voice to create change. Now, how can HR professionals convince the management of organizations to prioritize issues of wellness? There are people who look at, and I'm sure in your presentation you mentioned the issue of wellness. It's not a nice thing to have. It is something that is very essential to the P&L of organizations. How can HR professionals prepare so that they are able to convincingly put their case forward that we need to invest more in wellness?
So in terms of some of my slides, I'll go back to this example, because I understand that for the most part, management is usually concerned about revenue, because yes, it's important that the company is doing well, and the company is making money, etc. So if wellness can be shown to be something that improves efficiency, which can then result in increased revenue generation, as well as something which results in money that's saved for the company due to, for example, paying or not having to pay as many sick days as a result of different illnesses. If it can clearly be shown, if there's very clear data to show that a healthier workplace as a result of these wellness checkups results in increased profits and money saved, then it would only, as they say, if it doesn't make money, it doesn't make sense. So if it clearly shows that there's a very clear benefit to having healthier employees, that would be my approach in terms of the best way for HR to convince management. So it would be very important to track these key productivity indices that I listed in terms of absentee days, survey scores. If the healthcare claims in the company are reducing, if there's reduced turnover, especially because of health-related issues, then that would be clear evidence that these wellness initiatives are worth investing in.
Thank you. Thank you very much. In the morning, I was in a webinar where we spoke about the role of dashboards in understanding data. What can technology do so that it assists in understanding the impact of sickness at workplaces? What kind of technology can we use so that we are able to understand what is the impact of sickness to the overall productivity of organizations?
Right. So one of the things which something which can be quite simple to utilize with regards to this actually would be, for example, if there was a way in which companies could track, for example, how many steps people are taking. And that would be easy to do because of these smart watches that everybody has these days, where if we can clearly see that if people are very active, they're walking around, they're moving around in their workplace, it likely means that of these conditions that can reduce people's mobility, it probably means that they're not suffering from it. And then that added activity is something which can help them. Things like help them with managing their weight, help them with managing their blood pressure, with sugar control, mainly, especially in terms of exercise in general, in terms of how helpful it is in terms of preventing these conditions. Other metrics which can be used are things like certain surveys, just to track how people are actually feeling at work, and whether their healthcare needs are attended to. So making it easier, if there are ways in which certain surveys or this data can be implemented in different workplaces, either through digital surveys in which the information can be collected and easily compiled. These are just some small things or small ways in which technology, which might already be present in a company, can be used to keep track of people's health.
Thank you very much, Dr. Tayo, for that response. And now the other question I want to ask is this: how can medics and HR professionals and owners of business collaborate so that they can be able to do a better job in understanding what is the impact of sickness in workplaces?
So one of the major things is definitely knowledge, or being aware. One thing which I find very interesting is almost every month in every year is awareness for something. Like, for example, November was Men's Mental Health Awareness Month. Last month in October, that was Breast Cancer Awareness Month. So people say that knowledge is power, but I don't agree with that. Knowledge which is acted upon is power. That's what actually makes the difference. And so it would be what I would advise is definitely collaboration to organize a lot more health talks and even these medical camps or wellness camps on site where people can actually see a physician or a primary healthcare provider at their workplace in case they don't have the time or sometimes even the resources to be able to go to the hospital. And there are multiple different companies that organize or can be liaised with to organize these wellness checkups. Just to name a few of my head, I think I know Zuri Health is one. All of the major hospitals in the country offer wellness programs. Nairobi Hospital, Karen Hospital, Aga Khan, MP Shah. So being very intentional that people really should take care of their health. I know you can't force anybody to do anything, but people taking care of their health is in their best interest. So that's what I would say. That indeed, like more talks like this, especially even at the workplace, is something which would really help to empower employees to take care of their health.
Thank you very much, Dr. Tayo. There's a question here by Sami Nyongesa. What are some common misconceptions people have about chronic illness and how they affect their health and well-being?
So one of the biggest misconceptions about these chronic medical illnesses is that because they're not causing me any symptoms now, I don't have to take medication. And we usually see this with diabetes and with hypertension, because the most common reason people cite for going to the hospital is pain. When something starts hurting, is a headache, chest pain, stomach pain, pain in the legs, anything like that, people will end up going to the hospital. But when somebody is having high blood pressure and it's not causing any symptoms, it's not causing a headache, they haven't had a heart attack, anything like that, and they're not tracking their blood pressure on a daily basis, people can very easily ask themselves, why do I need to take this medication? It's not doing nothing. I don't feel any change when I take this medication. But that medication prevents a lot of things from happening downstream. Then, in terms of some other misconceptions that I tend to see, is thinking. Another major one would be thinking that this is not going to happen to you. Is one of the most dangerous ways to think, because it's very unfortunate thinking that just because either we keep ourselves healthy or we're in the prime of our career, that nothing is going to derail that. And what I want to say is that these conditions can strike at any time. There are people who can take perfect care of themselves and still develop, for example, cancer. So I'd say those are two of the biggest misconceptions, that because I'm not having any symptoms, I don't have to take care of this, and thinking that this is something that won't happen to you. Yeah.
Thank you. The last question as you prepare for your parting shot is, it will take more than a webinar like this for a person to be very competent in addressing what we have discussed tonight. Are there short courses that medics have prepared for people who want to understand this concept using shorter courses?
Okay, that's an interesting question. I haven't. The good thing is that there's a plethora of information on the internet, but then I understand that the internet can be a bit of a tricky place to navigate if you don't know exactly what you're looking for. In terms of how we always hear these stories of, I tried to ask Dr. Google something, and then it told me I have 3 days to live. So I haven't. What I can do is I'll search for some resources. I haven't come across any myself, but I can search for some resources which can help with regards to this, and then I can share it on email for it to be shared with everyone else.
Thank you so much. What is your parting shots? What should we remember from this conversation?
The major thing I would say is, once again, prevention. Things like, if you treat hypertension early or high blood pressure, it's possible to not get any of the complications for it, even into your late 80s. It's very tragic whenever I see the first time somebody is diagnosed with high blood pressure is when they're coming to the hospital with a heart attack. These cancers, if they are caught early, be it things like either feeling a breast mass, having some issues going to the bathroom for a short call as a man, noticing a change in your bowel habits, if they are caught early, treatment can be curative, not just trying to manage the symptoms. We can actually cure these cancers if they are caught early. So prevention is much better than, in certain cases, there aren't cures for these conditions, but prevention is much better than trying to cure or treat these conditions. And for anybody over the age of 40 years old, please go for a wellness check at least once a year. At least once a year. You might be feeling great. Just go have the basic tests which are done. Know what your cholesterol levels are, how your kidneys are functioning, your hemoglobin levels. Have some heart checkups, do a chest x-ray, just so that in case we find anything in an early stage, it can be dealt with.
Ladies and gentlemen, let us appreciate Dr. Tayo for that wonderful presentation. Next week on Tuesday, we will be talking about reigniting the fire, finishing strong and starting solar. Gentlemen, has been a wonderful discussion, Dandy and Atara Solutions. Thank you, Daktari. Thank you, ladies and gentlemen, for finding time to come and listen to this topic. Have yourself a good night and God bless. Good night.